Improving handoff communication in the perioperative setting. The need for improving handoff communication in the perioperative setting is important because communication errors are a leading cause in sentinel events and unexpected occurrences involving death and serious physical injury. Starmer, Sektish, Simon et al. States, implementation of a handoff bundle was associated with a significant reduction in medical errors and preventable adverse events. There are multiple handoffs that occur routinely in the perioperative setting: shift-to-shift handoff, duty relief, and transition of care, such as from the preoperative holding area to the operating room, from the operating room to the recovery room, and from the recovery room to the patient's room or home. Clear, complete, and accurate handoff communication is imperative to the implementation of safe continuity of care in such areas. The goals of this presentation are for the healthcare provider to understand the importance of effective handoff communication in providing safe and quality care, learn the elements that constitute effective verbal and written handoff communication, and to reorient the healthcare provider to the handoff tool. At the end of this presentation, the healthcare provider will be able to illustrate how situation monitoring and situation awareness during handoff communication aid in providing safe patient care, list the important elements in an effective handoff process, discuss the handoff tool with appropriate data for a mock patient handoff, and demonstrate usage of the handoff tool in a face-to-face handoff as giver and receiver, and be rated as satisfactory by the partner and observer. Teaching strategies to achieve these goals and objectives are lecture, group discussion, and role play. Understanding the importance of effective handoff communication in providing safe, quality care. Let's first define handoff communication. Handoff communication can be defined as the transfer of information and responsibility of care for a patient from one healthcare professional to another. Handoffs can provide an important safety check that enables relieving providers to review care and potentially correct mistakes. Starmer, Sektish, Simon et al. States, handoff miscommunications are a leading cause of medical error. Learning the elements that constitute effective verbal and written handoff communication. The handoff tool we will be using today will be the SBAR handoff tool. The SBAR tool is made up of 4 areas: situation, which includes symptoms, problems, patient stability, and levels of concern; background, which is date of admission, diagnosis, and relevant medical history; the assessment and action, which includes nurse's assessment of the patient and what care has already been implemented; and lastly, recommendation, what should be done and what is the treatment plan of care. When giving handoff report, the healthcare provider should use closed-loop communication to ensure information has been delivered and received as intended. The reporting healthcare provider should allow for questions and concerns of the receiving provider to ensure that all concerns and gaps of information have been answered or addressed. Let's look at an SBAR tool more closely. Notice the further breakdown of each area of the tool. By following the link below, you will be taken to a video that demonstrates effective handoff communication. In conclusion, it is imperative that healthcare providers in the perioperative setting develop and implement thorough handoff communication skills. Improvements in verbal and written handoff produce strong positive effects on patient safety and outcomes. Thank you.